What is Ankle Brachial Index test? Ankle Brachial Index test is a quick, non-invasive way to check for peripheral arterial disease or PAD. The disease usually occurs when the narrowed arteries reduce blood flow into the limbs. Your doctor might recommend you for an Ankle Brachial Index test if you experience leg pain while walking or risk factors for PAD such as history for tobacco use, diabetes, high blood pressure, high cholesterol, and restricted blood flow to other parts of your body. So the test is contraindicated if the patient experienced excruciating pain in the lower legs or feet and severe pain associated with lower extremity wound. Peripheral arterial disease can cause leg pain when walking or increases risk factors including stroke and heart attack. Before we start, we need to prepare the following: sphygmomanometer, ultrasound gel, and Doppler ultrasound. Make sure that the patient did not smoke for 2 hours prior to the treatment, and the patient should be in supine comfortable position approximately for 5 minutes. When the patient is already in supine position, make sure to prepare the Doppler ultrasound, the ultrasound gel, and your BP cuff. The width of the bladder is at least 40% of the limb circumference. First, you will assess the right arm and then the right leg, and then followed by the left arm and your left leg. Apply the cuff to the right arm, then palpate the brachial artery and mark the location. Then, you should apply the gel to the probe and place the probe at the area of the palpated pulse at an angle of 45 to 60 degrees. Inflate the cuff for 20 mmHg above the point of signal loss. Slowly deflate the cuff by 2 or 3 mmHg per second. Then record the right arm systolic blood pressure. Apply the cuff for 2 cm above the medial malleolus and repeat the same process to obtain its systolic blood pressure. Next is palpate and mark the posterior tibial artery and repeat the same process to obtain its systolic pressure. Repeat this process for dorsalis pedis artery and record its This is a grade of the ABI. So as you can see on the screen, there are 3 that were highlighted into red. So these are the things that you need to take note of. So this recommends vascular specialist. And the other 3 that were highlighted into blue are normal and near normal, except for 0.8 to 0.9, which is interpreted for some arterial disease and is recommended to treat only for risk factors. How to do a 6-minute walk test.
Will carefully explain the test to you and ask if you have any questions. Your blood pressure, heart rate, breathing rate, and blood oxygen levels will be measured before the test. You will have to walk as quickly as you can along a corridor of 30 to 50 meters. At the end of the corridor, you will turn quickly around a pylon without pausing, and then continue walking. You should try to cover as much ground as possible in 6 minutes. However, if you feel short of breath, have chest pain, or feel faint or dizzy, you will be able to rest briefly before starting to walk again. The technician will not speak to you during the test or encourage you. You should not speak to the technician or your friends and family. The technician will only tell you that you have 4 minutes left, then 2 minutes left, then 15 seconds left, and finally, to stop. A scale will rate your degree of breathlessness as well as fatigue level. Your blood pressure, heart rate, and breathing rate will be taken after the test.